that is Jeff online.
Jeff is on Teams. We also have Zach on Teams and 6 employees.
Please join me for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, Mr. Chair. Good morning, everybody.
Good morning. Good morning. Here on we are here on September 6th for our county board meeting. Gentlemen, we have an agenda in front of us. Is there any additions or deletions, any changes to the agenda?
Second.
We have a motion by Commissioner Wincher, a second by Commissioner Wilson to approve the agenda as before us. All those in favor signify by saying aye.
Aye.
Opposed? We have an agenda. Gentlemen, first thing on the agenda, we have employee recognition this morning. I look to our administrator, Mr. LeBlanc.
Thank you, Mr. Chair. I'll call Brad Vold, our Director of Health and Human Services, come forward, and the man of the hour, Mr. Jim Shabluski.
Did you know all these people were here for you, Jim? Well, it's not quite Jim's last day, and we said goodbye to him last week a little bit, but today he does get his plaque. I was actually looking at a little bit of old information on Jim, and it's funny that he started 20 years ago. And one of the things the former director, Steve Rieger, said when they hired him was that he had a good sense of data entry systems, and so did a good job of making things electronic back then. So he really was a man before his time. So now he gets to just relax, fish whenever he wants. When his buddies call him up, say, hey, can you go today? He can now say, yes, I don't have to work full time today. So, but we've really appreciated the 20 years you've given to us, and I know all the management team has really appreciated your knowledge, your patience with a lot of us, and how well you've managed the budget. So thank you, Jim, for your 20 years.
Thanks, Jim, for your time, and good luck, and I hope you get to spend time with the Lions group and doing all the things you enjoy. And on behalf of the county and the board, I present you with this print. It says, thank you for your dedicated service and for making Morrison County a place that our residents are proud to call home. You will be missed. Signed by all the commissioners, Jim Shabluski, 2002 to 2022. Thanks, Jim. Appreciate it. Thank you, man. Mr. Chair.
Gentlemen, I open the floor to you.
If I may,
Commissioner Wincher.
again, Jim, you think you're retired, you're not, you know, so now you're gonna start being busy, but at least now you can get up maybe a little later in the morning, but you'll be busier than ever now. So congratulations. Yeah.
I just
Commissioner
like to say
Lemire.
Thank you for your service to our county for the past 20 years. You had a difficult job and you will be missed.
Thank you, Jim. We know what you do, and you've kept everything in order, so thank you very much.
And Jim, I want to say thank you for your expertise and your patience with me and with the board, especially through the budget process. You know, your skill in being able to present things in a very defined manner for us for consideration is obviously very important for us to do our job. So this will be a transition for us, but we're very happy for you and for your ability now to have some flexibility in your life, and you look back at 20 years of a very tremendous career out there to the people of Morrison County. Thank you.
It's been a pleasure.
Floor is yours.
Well,
It's ready.
I really don't have what to say other than it's been a pleasure and an honor working for the county for the last 20 years. I've learned a lot, Waco, met a lot of great people here in Waco, our area type thing, and throughout the county.
Thanks,
Thank you.
Jim.
And I did forget to say one thing again, just showing his commitment, willing to do phase PRA and help in his transition and shake some of that knowledge loose and share it with his person that's going to be replacing him. So appreciate that commitment as well.
Thank you. Can we get one with you?
Push this back a little bit. Get up right up in the front row. Make sure it's not upside down.
Yeah, it is.
You're gonna have to scoot a little bit this way. Everybody shift. Come over this way. Jim, you're good.
Jim, thank you.
All right, one more time. Don't be screaming.
You know, gentlemen, that's a pretty darn good way to start a board meeting, isn't it?
Yes, it is.
I think that's all right. Gentlemen, we have the consent agenda that was sent out to, for us to peruse. Wishes of the board with the consent agenda. Is there anything, I should ask, is there anything the board members wish to have pulled from the consent agenda for further discussion?
Not I.
Not I.
Motion to approve.
Thank you, Commissioner Lemire. Motion by Commissioner Lemire and a second by Commissioner Wincher to approve the consent agenda. Gentlemen, this is a roll call. Commissioner Wilson?
Aye.
Commissioner Lemire?
Aye.
Commissioner Wincher? And the chairman votes aye. All those voting in the affirmative, the consent agenda is approved. Gentlemen, next on the agenda, on a more serious topic here, this is Suicide Awareness Month, and we have a proclamation here. So we have staff coming forward here. Good morning, Brad.
Good morning, Chair, Mr. Chair, Commissioners. So we have a suicide coalition. You're going to hear a lot more about it after the proclamation, but right now, some of the members of the coalition are here to share the proclamation. So if maybe you can introduce yourselves, and then I know Melanie's going to read it.
I am Jody Cox, here from the Guardian Ad Litem program.
Okay.
Sarah Pratt.
Molly Brown, I'm the intake social worker here.
Trace Meyer, I'm a mental health professional at Inspire Mental Health Center.
Melanie Erickson, Supervisor for Health and Human Services.
Jeff Bowman, Supervisor, Adult Services.
Logan Swensrud, MICA Coordinator and Juvenile Justice Social Worker.
Leslie McCoy, Family Medical Center, Community Health Worker.
All of these fine folks make up part of our suicide cohort, and of course there are others that were not able to join us today. And I will go ahead and read the proclamation for Suicide Prevention Awareness Month. Whereas September is known as National Suicide Prevention Awareness Month, which helps promote resources and awareness around the issues of suicide prevention. It teaches how to help others and how to talk about suicide without increasing the risk of harm. And whereas suicidal thoughts can affect anyone regardless of age, gender, race, orientation, income level, religion, or background. And whereas, according to the Minnesota Department of Health, more than 700 lives were lost to suicide in 2020. Whereas suicide is the 8th leading cause of death in Minnesota and the 2nd leading cause of death among people the age 10 to 24. And whereas the community of Morrison County is committed to suicide prevention by supporting its local Morrison County suicide prevention cohort, as well as maintaining membership in the Rivers and Lakes Suicide Prevention Coalition. And whereas everyone in our community can play a role in preventing suicide, we all need the occasional reminder that we are all silently fighting our own battles. A simple phone call, message, or hug can go a long way towards helping someone realize suicide is not the answer. And whereas support is available during a mental health crisis through the Suicide and Crisis Lifeline at 988 by call, chat, or text. And whereas there is no single cause of suicide. The Minnesota State Suicide Prevention Plan supports healthy and empowered individuals, families, and communities, coordinates effective programs, promotes suicide prevention as a core component of healthcare services, increases the timeliness and usefulness of data systems related to suicide, and sustains suicide prevention efforts. And whereas we can all help prevent suicide, you matter. Now, therefore, be it resolved that we, the Board of Morrison County Commissioners of the great state of Minnesota, do hereby proclaim the month of September as Suicide Prevention Awareness Month in Morrison County.
Thank you.
Mr. Chair, I'll make a motion to approve.
We have a motion by Commissioner Lemire and a second by Commissioner Wilson to approve the Suicide Awareness Month proclamation. Discussion.
I'll start off.
Commissioner Wilson.
I just want to thank you for all you do in this department. You know, like it said at the beginning here, you don't know where this comes from. And there's been a lot of stuff out there the last few years that people have had a hard time dealing with. And I just thank you for being there for people that need help.
Commissioner Lemire.
I would also like to say thank you, and you have this line in here that everybody's silently fighting their own battles, and it's nice that you're helping these individuals fight their battles. And it seems to be, every decade, it seems to be harder and harder for our young people nowadays, and my hat's off to all of you. Thank you very much.
And if I may, Mr. Chair,
Commissioner Witcher.
you know, again, this is something that, you know, pretty much affects everybody in the county and the state, because you know someone, a loved one or whatever that has taken their own life. But again, there's also other people that, you know, hurt from this too. So when someone does take their life, it's you and, you know, the family that, you know, this is something that is probably not preventable, and you can't blame yourself or something like that too. So again, this just gives you as members to say that, hey, you know what, there's help out there, and it's not something that's the first thing you should consider. So again, thank you very much.
I really can't add anything other than thank you. The proclamation directs us to some very specific points. So thank you for your work in a very difficult topic. Gentlemen, seeing no further discussion, all those in favor signify by saying aye. Aye. Those opposed, motion prevails.
Okay, if you can join up behind the board here, we'll take a photo with the proclamation, please.
You want us sitting, laying?
Standing or sitting?
I think if you sit, gentlemen, and then they can file it behind you.
Come on over, Mike, and sit.
I'll get in the center.
No, there's two and two now.
Two and two, so now they'll, so.
Should I readjust this chair for him?
All right.
Thank you.
Thank you.
Thank you.
Thanks for coming.
Yeah, thanks for being here.
Gentlemen, we have Brad and staff coming up with the Health and Human Services report, and I have a feeling we'll be talking a little bit more about the suicide program or not.
Correct. So it was about a year ago, maybe a little less, when our agency decided to apply for a grant, which really was not money in particular, but a support system to help us think about suicide prevention in Morrison County. And so these three took it upon themselves to write it and kind of move this thing along. And so we're kind of at the end of that grant period, but then the goal is sustainability. So we're just going to talk about kind of where we started, where we're at, and where we're going. So I'll turn it over to these three.
All right. Yes, it was the Minnesota Department of Health that coordinated the suicide prevention cohort meetings. And so they really took us through a process of learning, and that's kind of what I have outlined here on this first slide. You know, the purpose that we are meeting about is to look at data, to really understand the data, and then understand our community, and then move forward with strategies and developing that. And so I very much encourage doing a process to suicide prevention rather than just jumping into certain strategies, so.
We've recruited many stakeholders, community partners along this entire process, and it's designed to be a very slow, get a plan going and developed instead of just jumping in without having any specific sense of direction. And we've had very good engagement when reaching out to those in our community. For instance, you know, we have a lot of staff here at Health and Human Services, hospital, law enforcement, schools, pharmacies. So we've got very good engagement with our community team members.
One of the biggest goals of this group was to bring all the existing groups together into one place. Because we have all of these different groups and organizations that are working on suicide prevention, so our goal is to bring everyone around the table. And so that's just a list of existing groups that we're bringing to the table to work on this very difficult topic. So with that, we used our community health needs assessment data. So as I've brought in front of you before, we do a community health survey every 3 years as a community health board, Morris-Todd and Wadena County. And so between October and December, we sent out a mailed survey and we did an online survey to our communities, you know, talk about certain things. So we used some of this data in our suicide cohort group, the first one being, you know, how would you rate your overall level of stress? And so I think the concerning part with this slide is the pink line on the bottom is high, so it increased. So they, from 2019 to 2022, that increased dramatically. So, you know, that shows us where the stress level of our community is. Not surprising after the last 3 years, but that's what that slide is showing you. The next slide shows during the past 30 days, how many of those days have you felt sad, blue, or depressed? So what I want to point out is the amount of people on the top line that said 0 days dropped. And then the rest of them stayed either the same or increased. So that's also concerning that many people didn't have 0 days in a month that they didn't feel sad or blue. Also in that community health data, we asked, you know, why aren't people getting help? What is the reason? And that top line shows you an increase of they don't know where to go, which is incredibly concerning for us, as this is what we need to work on. We need people to have access. We need them to know where to get help. So that shows us that's what our group needs to focus on. And another one that went up is they couldn't get an appointment. So that shows that access is a problem. And so another area that our group needs to focus on. This slide shows us from 2009 to 2019 residents that died from suicide. And the areas I want to point out is, if you can see the jump in ages 45 to 54, that's significant. As well as you see an increase in 15 to 24 and ages 25 to 34. And so we need to get at, you know, what's going on in those age groups? Why are we seeing such a dramatic increase there?
So taking that data and then breaking it down even a little bit further by age group, looking at specifically the male population here. And it broke it down over the past decade, the first 5 years and the next 5 years. And you can see that almost every male subset age group decreased a little bit or remained the same, except for those age 45 to 60, or, 25 to 44. Those remained the same. There have been numerous male individuals over the past 5 years in that age group that have completed suicide. And then looking at the females, again, it is showing that the numbers remained about the same for across some of the subsets, and increased in the ages 5 to 24. Next, looking at suicide ideation and attempts. As you can see by this, females vastly outnumbered males with ideation and attempts. However, when looking at the actual completed suicide, the male population vastly outnumbered the female population. And that is strictly due to the access to more dangerous methods, those types of attempts compared to females. And so that is why the males have a higher frequency of completing attempts.
The next two slides come from the Minnesota Student Survey that our schools participate in. And so they ask about suicidal ideation and attempts for youth, and you can see junior high, grade 9, and then 11 or 12, depending on the year. And we can see that for males, there was a great jump in 2019 in those young men attempting or thinking about suicide by self-report. Otherwise, it continues to sustain at that higher level. And the next slide, which focuses on females, young females in high school ages. And you can see here that all areas, all grades are increasing in 2019 with suicide ideation. So that, again, is concerning. So, the next slide kind of talks about the risk factors and response options as a part of the suicide coalition at MDH, and learning about some of the counseling and areas that we can provide assistance on, that counseling on access to lethal means or calm training. We do have a member of our cohort that is specifically trained on that. And what that's designed to do is to help persons that are having suicide ideation, particularly if you think about veterans, and talk with them about not having access during those down periods to firearms. Because an impulsive decision in a time where you're feeling down, of course, that's greater lethality with firearms. So that's a very important service, and we're fortunate to have a member that's trained and be able to support that training or support that education for our county. It is important, and part of what the data shows us is that if you can stop a person in the time when they're thinking about suicide and provide intervention, that will actually that person will continue to change and improve and not complete a suicide. So it is important to identify some of those high-risk times and areas and provide that targeted intervention. And the list of these trainings help community members themselves learn how to talk about suicide in a way that changes the shame of it, make it okay is one of the slogans used, because just making sure that people understand that everybody can be down and you don't have to feel ashamed about that, and it's okay to reach out for help and it's okay to talk about it. Also making it more socially acceptable for others to talk with their friends or family about it and ask the appropriate questions, and giving training so we can ask in a way that doesn't increase the risk of suicide but actually decrease it. So that'll be some of our aims that we try to do here as a part of our coalition. And so the last slide just talks about a timeline for action, and of course, like I said, I learned that really taking it as a process is very important to implement change over time and actually be more sustainable. It's not just about going out and delivering a training or some community event. It's a long process of changing the community over time in our willingness to talk about this difficult issue and our willingness to provide support to each other and understanding. So this is, we'll identify some strategies, and we'll work on those, but I do not believe that will be the end of it. We have a very motivated group with us, and I foresee this work continuing on over years and over time.
Gentlemen, comments, questions, Commissioner Wilson?
Let me see, how do I say this? I noticed your one slide when they had on there, like, no insurance and stuff. Can you tell me the process that, if I was feeling that way, first of all, I probably wouldn't even know who to call, and how do you get involved? And then does it cost me money? Because probably a lot of these people are in that condition because of finances and this and that. Can you just explain that a little bit?
So a lot of our local crisis line service through the AMHI, do you want to
Yes.
talk about that a little bit?
Yes. The first place we direct all community members, because again, if you don't know, you don't know. We really encourage use of our crisis line, which is available 24 hours a day, 7 days a week, free of insurance. It's funded by our AMHI grant, and that is a direct access to law enforcement, mobile crisis outreach, which would come and then do an assessment. And again, that is independent of pay source. That is provided by our grant services. Now, again, one of the challenges is that follow through sometimes, if they may not have access. But if they do access mobile crisis outreach, there is follow-up that is provided, part of that grant, to get people connected. And they are able to then refer to adult mental health case management as an example, if they do, because that is available to anybody regardless of insurance, as long as they meet eligible diagnostic criteria for those services. And we have grant programs that are not funded by insurance. They are available to everybody.
And I think what that slide is saying is that they're not getting the preventative care that they need because they don't have insurance. So, so then they have to utilize more of those crisis services. Not that it always is preventable through preventative care, but that's, the reason they're not getting that ongoing mental health treatment that they might need.
And one of the things that was mentioned in there is the 988 rollout. That is the nationwide suicide it's the new 911 for suicide prevention. And we are in the process of partnering with our current crisis line through Northern Pines, how 988 and crisis line will work together.
People can also access mental health services through a sliding fee scale at Northern Pines, their mental health center. They're a 501c3, so they do have a sliding fee scale if you don't have insurance.
Okay.
Further comments? I just, I'll make two. I'm impressed with the number of members and the outreach in not just in Morrison County but across the region in the cohort in one of the first slides. The one other note that I took that really strikes me, almost hard to believe, was that in Minnesota, there's consistently more deaths by firearms and suicides than homicides with firearms. And to me, that kind of grabs and shakes you a little bit in the sense that it's rare I can get up and have a cup of coffee in the morning and have the statewide news on and not hear of a homicide. And obviously, it's predominantly in the more urban, heavily metro areas, but even so those numbers to me are really staggering. That, and I take them as fact, obviously, but that tells us that we've got problems out there, and we need committed people with a committed plan to address those problems. So I appreciate the work that all of you do on that, because this is a tougher subject.
If I may, Mr. Chair.
You may, Commissioner Wincher.
It could be a little political what I'm saying here, whatever, you know, but I have grandchildren, I have teenage grandchildren, and it'd be my children, they show me some of these platforms that these, media has, TikTok. My daughter showed me what is available for these kids to see. It's appalling, you know, and I say as a parent, and as a grandparent, boy, you gotta watch what your kids are watching, because it's like, how do they even allow this on there? Facebook is another one. And that's what I'm assuming that's what you're doing here. So, again, yeah, get out there and make sure you know what your kids are watching. So I appreciate everything you guys do.
Further discussion? Commissioner Lemire?
You know, we're gonna have those healthcare individuals within the schools that we're working on, I guess you could say. That's an initiative too that could assist children with ideations, correct?
Very much so. I was thinking about that. Our traditional school-based mental health therapists make a big indent on that problem, because they are served by a grant, so if there's no insurance. But then we're adding these additional staff for support now through the ARP funds, and I anticipate that additional support and care, because, you know, a lot of the research says that if kids can feel that caring, supportive adult that will have an impact on them, and feeling connected and not isolated is a big resiliency factor for not having suicidal ideation as a youth.
Great. Thank you.
You know, it's one of those things, we have a friend who lost an adult child due to suicide, and it's an immediate response to a very stressful situation that you cannot come back from. And so the hope is, how can we reduce that stress, that struggle that somebody's experiencing at that point? Because once you make that decision, there's no coming back, and you affect a lot of people.
And it's proven that they don't wanna die.
Yeah.
It's just, that's how sad they are.
Yep.
They think that's the only way out.
Yep.
Thank you for everything you guys are doing with this. This is good news.
Commissioner Wilson?
I just got one more. You know, it's still having something in front of people all the time that they're aware of where they can go. You know, and I'm thinking of the record, like where you'd have a little thing where you had this, but I'm not even sure that's the right venue anymore. Like Randy said, TikTok, Facebook, you know, those advertising and stuff that are on those things. But I think when you get in that situation, it's like, I don't know if they're aware all the time of where to go to get help. So.
And our hope is to pull together some focus groups and really talk about that with community members, because
Yep.
we want to hear from them. Where do you want to see this? What
Yes.
makes the most sense? And so that's kind of one of our next steps, is to bring those groups together and let's talk about this.
Yeah.
I mean, us as professionals, we may know where to go, but will we access it? But we need to make sure everyone knows where to go.
Kind of like a guy with a furnace. I don't need him until my furnace don't work.
Right, exactly.
And in January, they're very important.
That's right. So, thank you.
I think Melanie just wants to make one more comment.
Yeah, thank you, Brett. Mr. Chair, if I may.
You very much may. Go ahead, please.
This is our Chalk It Up event, which was started by the Rivers and Lakes Suicide Coalition, and so we are participating. I've distributed a lot through the county. I know our downtown businesses, many of them will be participating. There was a foster parent who also drew chalk on her and at the government center. I think others will be throughout the month of September. It is to raise awareness of Suicide Prevention Month, and also asking them to create messages of hope and resiliency, so positive messages. And so you can look forward to seeing that around the community the month of September.
Well, we thank you, we thank you all for your work, and we recognize the efforts that you put in, but I think we also have to look in the mirror too and say that all of us in the public play a role in being aware of the people around us, and reaching out to those people that there's value, I think, in going outside of our comfort zone, and we all, you know, we all think our world is so busy and we're so focused on the things that are right around us. I think we need to maybe take the blinders off more and be aware of our fellow man and woman around us that may be hurting, that we could easily walk past and not recognize. I think we recognize all the work that you guys do in that, but we also recognize that we all have a role to play if we want to be successful. Thank you.
Thank you very much, everybody.
Thank you. The next report, Mr. Chair, is Jim's swan song. It's the cost report, so I'll ask Jim and Derek to come up. And unfortunately, these reports have been more scattered and linked, or what do we say, postponed because of COVID, so the state has been challenged in getting these out, but we're happy to say we have the 2020 cost report. And so I'm going to talk a little bit about the bigger picture, and then Jim's going to talk a little bit about, and Derek, I don't know how much Derek will talk yet, but he's certainly getting a good grasp of what we do here. And so, but just giving you the big picture, the state, the county, and then Jim's going to talk about it from a taxpayer's perspective. So the first page is just kind of a guide, shows you what the support programs are, what the health social service programs are, and what the expenses defined are in centralized public aid, personnel, and non-personnel. So the first page gives you the next page gives you a sense of where we are at from 2017 to 2020 in terms of costs. The first one is support costs. So if you go from the top, I have to move my cursor just a little bit. Sorry, the first one is the total cost to vendors and administration. So once we get to the next page, it'll show you from a pie chart. But then it splits it out between support programs. So you can see from 2017 to 2020, our change is 19%. The state change is 7%. And then as you look at some of the other graphs, again, it just has some of the same information by program area. Towards the bottom is the human services cost per capita, and what I like to point out is where we rank. So we are in the middle of the pack. It's not something I think we want to be the highest in or the lowest in, but I think, you know, as we think about what we do here as a county, being in the middle is a good thing, because that just shows how much it costs per program area. The next slide is the cost by major program, and this is statewide programs. So you can see how much support programs cost, how much health programs cost, how much social service programs cost, and overall the state of Minnesota spent about $16.5 billion on health and human services programs. Then we tie it back to revenue and what the total revenue is and where it comes from. Federal is still the majority. The state is close behind, and then you have the county, miscellaneous, and total. Then the next slide is where we are at Morrison County with our health and human services total program costs. Overall economic impact of our programs is just over $101.5 million. And the support, health, and social services, and again, the healthcare area has generally been always the biggest driver. That's where the waiver programs are, that's where the long-term care costs are, and so that is always the biggest driver. And then it shows what our revenue shares are, where it comes from. The federal government has a 49% cost share, the state has a 45% cost, the county contributes 4%, miscellaneous collections 2%, for a total, again, revenue of $101.5 million. And so that's kind of the bigger picture. The next slide is Jim has broken it down in terms of what we do here locally. So I'll turn it over to Jim and Derek.
Okay, the main line you want to look at there is probably the 2020 total. That's what we call summing up all the departments. This is before combining with public health. As you can see, the largest expenditure there is for children's services. This is coming out of our county budget type thing. The best reimbursement in federal revenue is coming from out of child support. That is actually around 66%. They back off any incentives that we got to get from them. The next one, we call for state revenues, is that we call the best one coming in is probably through the mental health area. And then we call it miscellaneous revenue again is also the mental health. There, the miscellaneous revenue is coming from the insurance plans that are paying for mental health services for our clients. Overall, we actually from 2019 to 2020 reduced our costs by over $600,000. A lot of that has to do with 2020 was the first year that we started getting a return on our investment from South Country Health Alliance. Plus, we also got a large amount of CARES funding.
So overall, again, this just shows the magnitude of what the cost for Health and Human Services is. The one point I'd like to make around Jim's comment about the biggest cost being children's services, again, that's out-of-home placements, child welfare services, the cost to prevent out-of-home placements. And that is one of those programs that is funded more by local property taxes than state or federal revenue. And so it's a conversation we have with the state a lot about how to better support those programs. But overall, I think that's always a conversation about where does the federal government sit, where does the state, and then where do the local taxpayers fit in. So this is the cost report for 2020. And Jim made another good point, and that is this was previous to the combining our books with public health.
Questions, gentlemen? Commissioner Wilson.
Brad, this is 2020.
Correct.
So in 2021 and 22, are we at about $110 million?
We won't know that until the cost report comes out for 2021, an exact figure. So they're generally 6 months behind. So normally we would have gotten 2021 in about July, but again, it's been delayed now over the past couple of years.
You know, we seem to replace a lot of people. There's a lot of hiring in your departments through public health and stuff, but most of these hires, there's money that comes along with these programs to pay for those people, right?
That is correct, yep.
Okay,
Health plans, federal and state revenue.
okay, thank you.
Commissioner Wincher.
Thank you, Mr. Chair. Jim, on that last slide, you have payroll cost total is $6,500,000.
Correct.
Is that all taxpayer money, or is there state and federal built into that?
No, that would be the gross cost. That would be the gross cost for our payroll. Does not include the reimbursements. The reimbursements are spread out through the other columns in federal, state, and miscellaneous.
And I just wanted you to clarify that, so again, this is not all taxpayer money there, so.
That would be the cost if we did not file any type of reimbursement.
Okay, all right, perfect, thank you.
And again, some of these payroll costs and the staff that we have, it's important that they complete certain administrative requirements to reimburse nursing homes, group homes, just a variety of stakeholders or providers that help and support the people of Morrison County. So without some of the staff, we would not be able to reimburse some of those programs.
Mr. Chair,
Commissioner Lemire.
the biggest chunk of that pie was health, I believe you said, and that takes the nursing homes into consideration?
Nursing homes, yep, waiver programs, and some of our payments that we receive through health plans.
So would it be fair to say the biggest chunk of our pie is assisting elderly people?
Mostly elderly and disabled, yes.
Thank you.
I got one more question.
Commissioner Wilson, you had another follow-up.
Yeah, I do. When we talk about 49% from state, 45 from federal, 49, 45 county, so when we talk $100 million, for instance, we're looking at about $4 million comes from the county taxpayers, where the rest comes from federal and state to help with all these programs.
Correct.
I just want to make sure I'm saying that correctly.
That is correct.
So, thank you.
Gentlemen, further questions? Anything else?
Not I.
Jim, Derek, thank you.
You ready, Derek?
Questions to get off the list this week,
Yeah.
and then I'll be all set.
Attaboy.
Good job.
Thank you. Have a good day, Commissioners.
Thank you, Brad.
You guys have a great day also.
Gentlemen, next on the agenda, Amy is here with Land Services.
Morning, Amy.
See if I can read that. See which is first.
Berg.
Thank you.
The IUP.
Yep.
Good morning.
Good morning, Amy.
All right, I've got a few things for you today. First one is to consider the request for an interim use permit for a limited rural business from Joseph and Nancy Berg. This was recommended for approval by the Planning Commission with one condition. And that condition was that the IUP for the limited rural business shall be valid until the property is no longer owned by the Joseph and Nancy Berg Properties LLC.
I'll make a motion
Second.
with the condition.
We have a motion by Commissioner Wincher, second by Commissioner Lemire to approve of the IOP with the single condition. Discussion. Seeing no discussion, all those in favor signify by saying aye. Aye. Those opposed, the IUP is granted.
If I may interrupt, again,
Commissioner Wincher.
this is something that all the county board members, we sit in the audience, we
Yes.
listen to these, so it's not like, hey, we're just looking at a piece of paper. if you
That's
will.
correct. You receive the same packet of information that the planning commission gets, and then also attend the hearing, so yes. All right, Mr. Chair, are you ready for the second item?
Please proceed.
Okay, this one is to consider the request for an amended conditional use permit for Scenic View LLC. And this was also recommended for approval by the Planning Commission. And there were no conditions attached with this one.
Make a motion to approve, Mr. Chair.
We have a motion by Commissioner Lemire and a second by Commissioner Wilson to approve the amended CUP for Mr. Hardy. Discussion. Seeing no discussion, all those in favor signify by saying aye.
Aye.
Those opposed, CUP is granted.
All right, thank you. And the
Amy.
last thing I have, Mr. Chair, is at the last Planning Commission meeting, we also did have the public hearing for some amended or proposed land use control ordinance amendments. We did receive some feedback at that meeting, and so staff is working on coming up with some alternative language or some amended language. And so just wanted to give you an update that we are working on that, and we will be circling back at a later date with that.
Very good.
Thank you.
Thank you.
Gentlemen, anything else for Amy this morning? Amy, we wish you a great day and a great week.
Thank you, you too.
Amy, will you be in your office?
Yes.
Gentlemen, next on the agenda, Public Works. Good morning, Tony.
Good morning, Mr. Chair. Good morning, Commissioners.
Morning, Tony.
We've got 4 items for you this morning. As we kind of discussed in some of our planning sessions, a lot of our construction's wrapped up for the year with the materials that we could get. So that brings us to our first 3 requests for action. So our first one here is authorizing the resolution of a certificate for final payment on contract number 301. This is our CASA 15 project. It was a reclaim and new pavement down in the southwest corner of our county.
So moved.
Second?
We have a motion by Commissioner Wincher, a second by Commissioner Wilson, to approve of this resolution for contract number 301. Discussion. Seeing no discussion, gentlemen, this is a roll call. Commissioner Lemire.
Aye.
Commissioner Wilson.
Aye.
Commissioner Wincher.
Aye.
The chairman votes aye. All those voting in the affirmative, motion prevails. Tony.
Our second item here is authorizing the resolution for certificate of final payment for contract 302. This was our large bituminous paving program for the year. As you can see in the summary there, it covered numerous roads and a lot of mileage.
I'll make that motion.
Second. We have a motion by Commissioner Wilson, a second by Commissioner Lemire to approve of payment of contract 302. Discussion. Seeing none. Gentlemen, it's a roll call. Commissioner Wincher.
Aye.
Commissioner Wilson.
Aye.
Commissioner Lemire. Aye. The chairman votes aye. All those voting in the affirmative, resolution 302 is passed. Tony?
Our third one is our maintenance striping contract. This is an item that we do yearly, and it just upgrades or refreshes our maintenance striping throughout the county. This was completed by Sir Lines-A-Lot, so I'm requesting resolution for the certificate of final payment to contract 2201.
Second.
So we have a motion by Commissioner Lemire, a second by Commissioner Wincher for payment on contract number 2201. Discussion. Seeing no further discussion, gentlemen, this again is a roll call. Commissioner Wilson.
Aye.
Commissioner Lemire. Aye. Commissioner Wincher.
Aye.
The chairman votes aye. All those voting in the affirmative, resolution 2201 is passed.
So our final item is requesting traffic control change on CASA 15. When we redo a road or upgrade the pavement, we evaluate all the signing and update what needs to be done. When we were going through the CASA 15 project this past July, early August, we found some non-conforming signs that we would like to remove and change. If you see the map there, we have 4 locations. This is just south of Swanville. So one of the locations will be the intersection of CASA 15 and 10th Avenue. The second location would be intersection 2 labeled there. That'd be 100th Street and CASA 15. And then our last 2 are the corners to the east there, intersection 3 and 4. Those are both unnamed roads. They're maintained by Swanville Township. Currently, all those signs are yield conditions. The rest of our system all has stop conditions as they come onto CASA 15. We'd like to remove the yields and make them a stop condition, so then we have conformity throughout our whole corridor.
So moved.
Second.
We have a motion by Commissioner Wincher, a second by Commissioner Lemire for the signage on CASA 15. I'll make one comment and say thank you, Tony, for especially for the location 3 and 4 there, and that what's been a difficult corner there just north of Uppsala, and that since I've been on the board, I've been asked many times if the county would look at helping to address public safety there. So I appreciate your work and your staff's work down there too. And I'm sure DJ's had plenty of input on that also there. Gentlemen, we have a motion, a second.
I got a question.
I'm sorry. Commissioner Wilson, please.
As long as we're putting stop signs on here, is it possible to take a look at if any of them need to be lit up stop signs, or how we're ever going to approach that? And I don't know if that really pertains to this one or not, but if we're going to put up new signs, does that make a difference?
In this situation, that would be a different subject. So what
Okay.
we're doing here is requesting a traffic control change, moving from a yield sign to a stop condition. What you're referring to is upgrading our stop signs to a condition that promotes additional awareness. If we were to approach that, I'd recommend that we evaluate our intersections throughout the county and then come up essentially with a hierarchy or a reason why we'd be replacing specific locations. We'd want to do a cost evaluation of what those signs would cost. And I just don't want to put the county in a situation where we upgrade one stop sign and then every time someone requests, they're expecting it.
Yep.
So we should definitely have a list of high priority and lower priority or mid-priority and down to evaluate and address those concerns. And that's something we can develop if you wish.
Okay, thank you for your comments.
Sir.
Any further discussion? Any further discussion? We have a motion and a second to address the signage on CASA 15. All those in favor signify by saying aye. Aye. Those opposed, motion prevails. Tony, wish you a great day.
Thank you, sir.
Thanks, Tony.
Thanks, Tony.
Gentlemen, we're right on time. I look to Mr. LeBras, our administrator, for the administrator's report.
Thanks, Mr. Chair, and yes, we are right on time. That's pretty neat. So as the county continues to prepare for the resignation of our incumbent auditor treasurer, we are working through the process of that to ensure that our systems, functions, and practices continue to provide service to the residents of the county. And as we've been talking, the first step was to accept the resignation, which the board has. The next step in this process that I brought up at planning session was a subsequent appointment and proper compensation for those that are then going to step up and continue to provide those services. So my first resolution I'm bringing before the board today has 3 of our current employees highlighted on it and described here. Each of these 3 ladies will have a significant contributions to covering down and to assisting the county through this resignation of our auditor treasurer. So if I may read the description. Approve the temporary appointment of auditor treasurer duties to the resignation of the auditor treasurer until the position is filled to the following. Ms. Denise Vogel, who works in our DMV, should be appointed as the temporary deputy registrar, which is in a subsequent RBA as well, with a pay increase 5 grades to grade 28, step 9, $37.64 an hour. Ms. Debbie Simonetz as a temporary auditor treasurer, appointed as the auditor treasurer to grade 24, step 9, and another 5 grade increase. $32.17 an hour. Ms. Joyce Call as a temporary chief of elections administrator at a grade 24, step 9, $32.17 an hour. I can read the, excuse me.
Excuse me,
Mr. LeBlanc, the language that's on the screen in front of us does not reflect what you just read.
Excuse me.
Should we be going off of what we have in front of us on the screen?
Yes, Mr. Chair.
Would you, for the record, I think we should have you repeat that.
Approve the temporary appointment of auditor treasurer duties due to the resignation of the auditor treasurer until the position is filled to the following. Ms. Denise Vogel as a temporary deputy registrar at a grade 30, step 9, $40.72. Ms. Debbie Simonetz as the temporary auditor treasurer at a grade 26, step 9, $34.80. Ms. Joyce Call as a temporary chief of elections administrator, grade 26, step 9, $34.80. Each of these 3 ladies would be receiving a temporary 5 grade increase to their current pay on the county's table.
Mr. Chair, I'll make a motion to approve.
Second.
We have a motion by Commissioner Lemire, second by Commissioner Wincher, to approve of these temporary pay increases. Comments?
If I may, Mr. Chair.
Mr.
In addition
LeBlanc.
to just that increase, the board is also appointing a temporary auditor treasurer in this resolution as well. And then the following, the board is asked to appoint a driver's licensing agent. So there's 2 distinct actions here.
Gentlemen, comments? Everybody understands where we're going with this?
This is, Mr. Chair.
Commissioner Lemire, please.
We've had discussions on this, and these ladies are kind enough to step up and fill the place of our auditor treasurer who is leaving us. We had discussions on this a couple times in the past at previous meetings, and this is the fair thing to do. And we're grateful for you guys to step in.
I couldn't say it any better. Thank you, Commissioner Lemire. Commissioner Wincher.
I'm going to put Commissioner Wilson on the spot. We just had a little brief discussion this morning about what was listening on the news versus there. If you could repeat that for the public, I'd appreciate it.
I heard on the news today that the county decided to appoint an auditor, but that's not really true. We're appointing an auditor to fill this term, and then we'll decide what to do after the election. Am I correct on that? And that's the way it was in the paper last week, I think that way, but I come across the news as we have appointed a new auditor for this position, and I just want to clarify what that really means in my eyes anyway.
Thank you for that, Commissioner Wilson, because I'll second that clarification. We've asked, and Ms. Simonitz has agreed to act as the interim auditor treasurer here to fill out the term of Ms. Robinson. And this board will, after the election, will then have the discussion as far as how we will proceed. And I thank Commissioner Lemire for your comments on how we got to this point. But since all three of these ladies are here, I'll take that brief second to personally say thank you for stepping up an even greater level of leadership in a transitionary period here. And we're grateful that we have all three of you here and your level of professionalism.
Before you vote, Mr. Chair, I just would want to, it's not noted in the RBA, but the start of this would be effective upon the resignation of the Auditor Treasurer, so the 17th then of September.
Yes, thank you for that timeline notification there too, Mr. LeBlanc. Gentlemen, further comments, questions? Seeing none, gentlemen, this is a roll call. Commissioner Wincher.
Aye.
Commissioner Wilson.
Aye.
Commissioner Lemire. Aye. And the chairman votes aye. All those voting in the affirmative, motion prevails.
Thank you, Mr. Chair. The next is, in addition to this, and the same topic of the transition of responsibilities here, from the state of Minnesota, we also have to have the board appoint a driver's licensing agent for the county to replace Ms. Robinson. So this resolution reads, whereas the Morrison County Board of Commissioners has received a letter of resignation from Chelsea Robinson as the Auditor Treasurer and Deputy Registrar. Whereas Morrison County will continue to provide driver's licensing services to the residents of Morrison County, and whereas Morrison County needs to appoint the responsibilities of the driver's license agent, and now therefore be it resolved, the Morrison County Board of Commissioners, that the resignation of Chelsea Robinson has been accepted, and that Denise Vogel has been appointed as the temporary Morrison County driver's license agent.
So moved, Mr. Chair.
Second.
We have a motion by Commissioner Lemire, second by Commissioner Wilson. Discussion?
Is that date, the 16th, on here somewhere? I mean, I know it's not on here, but that's what we're talking about.
And adopted the 17th day of September 2022 is what we need to fill in there.
Okay, thank you.
Mr. LeBlanc, just so I'm clear on this, in the past, has it been the practice that the auditor treasurer would serve as the driver's license agent? Is that within our organization, or is that kind of how it is in other counties too, just from my understanding?
I can only speak for ours, and
Okay.
that's how we were, that's what Ms. Robinson also performed those functions, and that authority. And with her absence, that authority would need to be granted in order to continue to provide this service.
Very well, thank you. Further discussion? Further discussion? Seeing none, all those in favor signify by saying aye. Aye. Those opposed, motion prevails.
Thank you, Mr. Chair. And my last, well, I have two more items. So the next one is just an announcement. I've started to receive invitations from AMC, the Association of Minnesota Counties Annual Conference, 5 through 7 December. So just have a placeholder on your calendars if you'd like to attend.
And that will take place?
December.
Where?
St. Paul, I believe. check real quick. The Doubletree Hotel in Bloomington, excuse me, Doubletree Hotel Bloomington.
Let me know, I can get you registered. Let me know.
I guess the question I have there, can you change those reservations if we're not elected? Oh, yeah, that's right, we'd still, because we're still till the first of the year, yeah, that's right.
Okay, and then the last item, Mr. Chair, is a resolution to go into a closed session following our committee reports, but I do have an amendment because we won't have board again. Obviously, next Tuesday is a planning session. So it would read, whereas Morrison County is currently negotiating with labor unions representing Morrison County employees in the upcoming labor contracts for the period beginning 1/1/2023, and whereas pursuant to Minnesota Statute 13D03 Subdivision 1 Bravo, the county board by resolution may close a meeting to discuss labor negotiation strategies. Now therefore be it resolved, the Morrison County Board of Commissioners hereby closes the county board meeting on September 6, 2022, and planning session September 13th, 2022, in order to discuss ongoing labor negotiation strategies.
Would you like, Mr. LeBlanc, would you like us to pass that resolution now and then, or would you like us to do our schedules and the calendar before we go into executive?
Committee reports and then.
And then go back and pass this resolution? Are you
could
okay
pass
with
the
that?
resolution, and then we would move into a close after committee reports.
Chair, I'll make a motion to approve this resolution to go in effect after we give our committee reports.
Is there a second?
Second, or
We have a second. We have a motion by Commissioner Lemire, a second by Commissioner Wincher to approve of the resolution to go into executive,
break after
into executive session. All those in favor signify by saying aye. Aye. Those opposed? Gentlemen, let's quickly go through our calendars.
And the dates are,
And Tabitha, I'll have Commissioner Jelinski, who is online, I'll have him get a hold of you when he can to add into that. But Commissioner Wilson, can you start us off with the dates? I'm sorry, the dates will be
September 11th through September 24th.
okay, let me see here, I gotta keep touching them. Okay, we have, on the 13th, we have a board meeting, on,
planning session?
yep. and-
Planning session at 8:30?
Yep. We got a budgeting meeting after that. And in the evening, we've got the Board of Adjustments. Okay, let me see. On the 14th, there's a department head meeting in this room here. The 15th and 16th, there's AMC conference. Is that correct? That's what I got?
that's an arrowheaded.
Yep, that's what I got on this one.
What date, Mike?
The 15th and 16th, yep. And then the 20th, I got a board meeting at 9 o'clock here.
That board meeting will be moved, gentlemen, to 10 o'clock a.m. because at 8:30 that morning is the Camp Ripley Water Festival.
Correct.
Which date is that?
That is September 20th
And the 21st.
and the 21st, yes, the Water Festival.
Okay, and then I have community development at Pine Country Bank at noon. And then I had the Water Festival, but we talked about that already. Then on the 22nd, I have Rum River Watershed meeting in, I'm gonna say it's in Malacca, I think. It could be virtual, but I'm not sure yet. They haven't sent out the,
And that's Rum River, right?
yep. And that's to the 24th. That's it for me.
Commissioner Lemire,
The 12th, Yellow Ribbon Committee, 5 o'clock. 13th, he's got them. Got Long Prairie Watershed on the 15th, but I think that's just on a phone call, so you don't have to worry about that. 21st, HRA meeting at 9 o'clock at HRA. And I got Public Health Advisory meeting, 5 o'clock PM, and that's gonna be in the Belle Prairie Conference Room.
I'll need to get with you on that location.
Okay. I got a problem here, Houston. I got HRA on the Thursday too, so I don't know which one of them is right. I'll have to get back to you on that one.
Okay.
And that's it.
Commissioner Winter?
Okay, above and that, on the 20th, I have Great River Regional Library. That's at 5 o'clock, and that's gonna be in St. Cloud at the library. I have TCC on Thursday, the 22nd, at 5:30 here in Little Falls. And that takes care of everything else.
Excellent. The only thing I can add to this is the 22nd, Thursday, the 22nd at 6 PM is Region 5. Other than that, oh, yes, you have a question.
Do we have soil and water on the 23rd?
Nope, 30th.
30th. And then,
I have airport on, is it the 15th there? The 3rd?
do you have a Mississippi Headwaters Board also on the 23rd?
I would, yes.
Okay.
Pioneer Days are the 15th, 16th, 17th, 18th.
And then a big thing, big festival's this weekend, right?
Arts and
Oh,
crafts.
yeah.
What do they call it?
Arts and crafts and antiques and collectibles. And Commissioner, Mr. Chair, for Commissioner Lemire, I believe that yellow ribbon was moved to the 19th from the 12th.
Commissioner Wilson, you have something else?
I just want to say Commissioner Jelinski is very missed when it comes to calendars.
Yeah,
He kind of's got everything on his calendar for
When,
us.
when the leadoff hitter, is on the injured reserve, then, it makes a hole in the lineup, so.
And just to verify, we just have Board of Adjustments, no Planning Commission.
Yes, on the yes,
There's nobody on the agenda for the Planning Commission.
right. It's in your mailbox.
So gentlemen, if there's no other issues with the calendar or anything you'd like to bring up as far as meetings, why don't we take about 5-6 minutes here or so, and then we'll go into a closed session. All right with that?
Sounds good.
All right, so